Governor Romney tells a very nice story about what his plan is now. It wasn't his plan when he was in a position to do a plan. When he was governor of Massachusetts, he put forth Romneycare, which was not a bottom-up free market system. It was a government-run healthcare system that was the basis of Obamacare, and it has been an abject failure, and he has stood by it. He stood by the fact that it's $8 billion more expensive than under the current law. He stood by the fact that Massachusetts has the highest health insurance premiums of any state in the country. It is 27% more expensive than the average state in the country. He's standing by it, and he's going to have to run against a president. He's going to have to run against a president who's going to say, well, look at what you did for Massachusetts, and you're the one criticizing me for what I've done. I used your model for it. And then
so much of what the senator said was wrong. Let me mention a few other things. First of all, the system in my state is not a government-run system. 92% of the people had their own insurance before the system was put in place, and nothing changed for them. They still have the same private insurance. And the 8% of the uninsured, they bought private insurance, not government insurance. And the people in the state still favor the plan 3-1. And it certainly doesn't work perfectly. Massachusetts, by the way, had the highest insurance costs before the plan was put in place and after. But fortunately, the rate of growth has slowed down a little less than the overall nation. And one of the things I was proud of is that individuals who wanted to buy their own insurance saw their rates, and when they were not part of a big group, saw their rates drop by some 40% with our plan.
The fact is that, yes, you're right, Governor Romney, 92% of people did have health insurance in Massachusetts. But that wasn't private sector health insurance. A lot of those people were, as you know, on Medicare and Medicaid, so they're already on government insurance, and you just expanded. In fact, over half the people that came on the roll since you put Romneycare into effect are fully subsidized by the state of Massachusetts, and a lot of those are on the Medicaid program. So the idea that you have created this marketplace and with this government-run healthcare system where you have very prescriptive programs about reimbursements rates, you have very prescriptive programs just like what President Obama is trying to put in place here.
First of all, as you probably know, Medicaid is not a state program.
Of course it is. It's a state and federal program.
Medicaid is as demanded by the federal government, and it's a mandate. It's a mandate by the federal government, and it's shared 50-50, state and federal. The people of Massachusetts who are on Medicaid, I would like to end that program at the federal level, take the Medicaid dollars and return them to the states and allow states to craft their own plans. That would make the plan we had in Massachusetts a heck of a lot better. My view is get the federal government out of Medicaid, get it out of health care, return it to the states, and if you want to go be governor of Massachusetts, fine. But I want to be president and let states take responsibility for their own plans.